looking, it immediately, I think, Charcot. I had a patient who went to Europe, I will not say the country, and had a bone biopsy looking for osteomyelitis. So it wasn't done here, it's in Europe. Okay, so the doctor was looking for, the doctor was so sure that this is an infection that he thought it was hematogenous osteomyelitis. And once the bone biopsy came back negative, then an orthopedist saw that, oh, this is Charcot. So that's how it can misguide us, you know, this Charcot towards infection. So many ways to immobilize it. There are many fancy devices that can be done. What is the problem with Charcot? What are we trying to prevent? We're trying to prevent this. What happens with a Charcot foot, the whole foot dislocates. This is the rear foot. It's supposed to be pointing that way. You see how it's pointing down? This has dislocated all the way down. And this is the remaining part of the foot. It has compressed. So the foot becomes shorter and it becomes a rocker bottom foot. So it is, instead of an arched foot upwards, it becomes arched downwards. Okay? So this rocker bottom, so far, okay, we have a rocker bottom foot. We still walk on it, no? The problem with the rocker bottom foot, patients get the famous Charcot ulcer. So this midfoot ulcer is because the pressure is all in the midfoot, and you get this ulcer, and these ulcers are very, very difficult to heal. So if managed properly, if a Charcot foot is immobilized early, it will not go into a rocker bottom. You will get a flat foot. Oh, I thought I had the x-ray of the flat foot. So you will get, if you get a flat foot, that's an excellent result. As long as you prevent the rocker bottom deformity, you prevent the ulceration, it's fine. And once the temperature normalizes, once the patient, the swelling becomes normal and temperature normalizes, they can go into a diabetic shoe and live a normal life. And some arch sometimes will develop in the future. So I'll end with patient education. Using patients is very important in diabetic foot and trying to prevent ulceration. This is an example of a study that was done in Texas where patients were given thermometers, home thermometers, dermal thermometers to measure temperature. The point from this study is before we ulcerate, before an area ulcerates, it becomes warm. Usually 4 times warmer than, let's say, the week before. If you're measuring an area temperature of a certain area that you're expecting to ulcerate, if it's going to ulcerate, it becomes inflamed and it becomes warm. So patients, when given thermometers, they were divided into 2 groups. The ones who measured